Good morning and welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN Weekly for Saturday, December 21st, 2019. This week, the U.S. Congress passed and the President signed into law an appropriations bill that included the Secure Act. Here to weigh in with what that may mean, David Levine. He's a principal with the Groom Law Group, an employee benefits law firm based in Washington, D.C. David, thanks for making time for us this morning.
Good morning. Thanks for having me, Jeff.
This has been an amazing week, and we had on earlier in the week your colleague Kevin Walsh, and the two, for the audience's benefit, they are known as the Legal Eagles, or as I call them, retirement rock stars. But David, in all seriousness, in a momentous week, the passage of an appropriations bill with the Secure Act, and it looks like the President has signed the bill, at least, or intends to. Can you just weigh in with your perspective? Really interesting to hear what you have to say. And for people who don't know David, he's very well known and talks to a lot of influential people within the retirement marketplace. So David, please tell us what your thoughts are.
My thoughts are it's interesting how everything comes together last minute. Many of you have been in this industry for like 13 years. You know how, Jeff, it's time flies. 13 years ago, we had the Pension Protection Act, and that all came together last minute, and that's what we've had here. And you have a bill that brings together Secure, and we've heard tons about Secure. Obviously, it promotes more employer plans, lifetime income, distributions, coverage, those types of things. But what's also really interesting is now we have to pivot. There's more legislation and regulation on the tracks behind it, the Retirement Security and Savings Act. But also, for now, we have to say, how do we make this work? And to me, that's the discussion we move into as we turn into 2020.
So let's talk about that. How do we, if you're an employer, so if you sponsor a retirement plan, if you're someone who's thinking about sponsoring a retirement plan, because we get multiple employer plans or MEPs here, or if you're a participant, what are some of the things that you would recommend or think about when talking with some of your clients?
Sure, absolutely, Jeff. I think there's a couple things that immediately come to mind on my end. Number one, let's talk about it from the plan sponsor perspective first. There are some changes that really will affect how your plans operate over time. Number one on that list is clearly minimum distributions. It's a wonky type of thing. And for those who live it, yeah, we can talk all day. In English, it was this: you have to start taking your money out of your plan when you're 70 and a half, or if later, retire. And they pushed it back to age 72 starting next year. And it's a change that really stretches out payments, but they paid for it one way. Because, you know, any bill in Congress, you got to find a way to pay for it, or sometimes. And given that, the way that they paid for it here, and part of the bill is that it says in the bill that basically when you die, something people have done for estate planning, and it's not always the richest of the rich. It's sometimes people, like, it could be public service, it could be professionals, who said, you know what, I'm going to delay taking my money out of my 401k because my beneficiaries can take it out over their lifetime after I die. With some exceptions for like spouses and people who have special needs and your trust, you're going to have to take that money out over 10 years now, which definitely has an estate planning impact, and employers should be aware of that. Number two, a big one that comes to mind for me is also coming soon, but we don't have to start counting until sort of now, that people who work for 3 years as a part-timer between 500 and 1,000 hours, you're going to have to let them into your 401k. If you're worried about money, you don't have to give them a match. You don't have to give them an employer contribution. But you are going to have to let them in, which means there's payroll costs, payroll coding, system things. And a really big thing you're going to have to face, in my mind, is you're going to have to say, okay, well, what does this mean for our fees and record keeping? All this is going to play out. So your consultants and advisors will be in the middle of that discussion as well. Those are two big ones. The last one I'll add on for employers, I think is a big one, is also if you're doing a qualified automatic contribution arrangement, a QACA, not everybody does it. They allow you to do the cap on the 10% default automatic enrollment kind of goes up to 15%. And that's a big improvement. But a lot of people are already pushing that limit anyway. Those are three quick items.
Yeah, David, not to get ahead of ourselves, and next year is an election year, but you and your colleague, Kevin Walsh, are often talking about some of the other things that the Congress and the Department of Labor are thinking about. I know if Kevin were here, and he was on the program earlier in the week, he always talks about missing participants. But what's top of mind for you? And I don't want to put the cart before the horse, but what are things that the retirement industry, the regulators, the legislators are thinking about for 2020 and beyond?
Well, I think for 2020, I think in terms of legislation, there's lots of cleanups, there's harmonization. For instance, the Retirement Security and Savings Act has things about trying to treat Roth and pre-tax monies pretty similarly. That's a big one that I think jumps out, like about rolling money out of a Roth IRA into a plan. There's been a lot of discussion about that. I think that's out there lurking. And although it ties back to secure, I think this is a big item. I think you're going to see a lot of focus from the regulators on the open MEP discussion. I think it's good to come back. I think that's a big item. It doesn't kick in until 2021. What does it mean if you are a service provider, whether you're a record keeper, a consultant, or a fund provider? Are you going to create your own MEP? How are you going to sell it? I think the big discussion to be had is how do we implement all these rules? There's a lot of pieces of the MEP legislation that really are open. We did this request for information from the Department of Labor after some of their guidance this year that ties to MEPs. But there's a lot of questions of, okay, well, if I'm in charge of a MEP, how do I get paid? And who's responsible for making sure dollars are collected and properly contributing? Because there's a provision in the pooled employer plan guidance that talks about the trustee having a process and actually making sure contributions are properly gathered. For anybody who's ever dealt with a multi-employer pension plan, it's just like that. So I think those are a couple quick things. Oh, and of course, don't forget e-disclosure. I think the real discussion is how does that roll out? How does that go? And of course, to channel my colleague, Kevin Walsh, you got to figure out that also means, does that help find your missing participants? We'll have to see where that goes.
Yeah, absolutely. And David, I mean, you make a really great point, I guess, last minute or so. Implementation on these types of bills, and you lived through AgTrail, and I worked as a record keeper trying to implement those sweeping changes. This is as significant. Those things take time to implement. You mentioned the MEPs. So we shouldn't expect that people are going to wave a magic wand. The Congress, the president, they've done their job, and now all of a sudden we're ready to go, right? These things take time to ramp up. You've got systems, programming, communication, education. There are things that I probably haven't even ticked off, and we don't have time to tick off.
I just disagree. Everything's going to be perfect as of January 1. In other words, you're 100% right, Jeff. I completely agree. I do think it will take time, and I think a word to cause everybody to breathe. My theory is there are provisions that do apply as in a week and a half, in a week from now. That's okay. There's transition relief. It's going to take time. We will get there. The key point on this is that it will take some effort, and the sky is not falling, but there's a lot of decisions to be made. Like I'll even tell you today, I was starting to organize in my mind the MEP discussions and starting to do my top list. It's something we could do on the Pulse. I was thinking of doing it on LinkedIn. Or sort of, here's a single item, because there's so many little nuances.
Yeah,
that they'll get worked through, and we will get there. Is the short answer.
Absolutely. But it's certainly something that committees, employees, people can start talking about, and I think it's a sign, a positive sign, in my opinion, to get more people covered. That's always a good thing. That's what we want. And congratulations to the industry, but also members of Congress, the regulators, all the people, the associations, all the people involved. It seems like it was really bipartisan and unanimous.
It was. It's pretty amazing that way. Normally, things don't seem to work that way in D.C. these days. So it's nice to see something where we all can get along. Absolutely.
Well, David, thanks so much for making time for us on this Saturday morning. Appreciate it. And we'll look forward to talking with you and your colleague, Kevin, on the podcast, because you're also regular contributors there. But until then, have a wonderful weekend, and we will talk with you very soon.
Thanks for having me, Jeff, and happy holidays to you.
Thank you. Well, thanks so much, David. It's always great to get yours and Groom's perspective on new legislation, especially sweeping legislation like the Secure Act. And when we come back, we also talked about healthcare this week. We'll talk about soaring healthcare bills and how technology could potentially blunt that explosion in cost. So stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Welcome back. You know, this has certainly been an amazing week when it comes to retirement legislation, but we also talked about healthcare. Let's take a look at my interview with Devin Banerjee. He's a senior financial services editor with LinkedIn, and we sat down to talk about soaring healthcare bills. Let's take a look.
Yeah, that's right, Jeff. So, you know, as the year comes to an end, and actually the decade comes to an end, we're looking at a lot of stats about cost of healthcare spending, you know, here in the U.S. So what a lot of our smart voices on LinkedIn are talking about is, look, the healthcare industry had almost a record year in terms of profits this year. That's expected to continue directionally next year. And what does that mean for, you know, patients? Well, it's coming from hefty bills for patients. The U.S. spent just north of $3.5 trillion this past year on healthcare. It's an average of almost $25,000 to cover every family. We saw household spending, you know, cross $1 trillion this past year. And look, as you know, it's not a surprise, you know, Americans among developed countries are spending, you know, the highest proportion of income on medical expenses. So the U.S. in terms of GDP is allocating about 17% to medical bills.
Wow.
The global average is only about 8.8%, Jeff. That's according to the OECD.
So twice as much.
Twice the average, yeah. So this trend is really not abating, which many people thought, you know, a year ago or several years ago. And so, you know, all of those solutions and you know, tech-enabled solutions and regulation have not really made a dent yet. And so, as you mentioned, we did put out our 20 big ideas for 2020. One that's kind of related, actually, is a global shortage of nurses, actually. Mm-hmm. The World Health Organization has really become quite vocal about this, including on LinkedIn. And so this is more of a global trend, not just in the U.S., but they're seeing a shortage of about 18 million nurses over this next coming decade.
Okay. Wow.
But yeah, nurses, midwives, particularly acute, of course, in low and middle income countries. So we're not talking so much about the U.S. But what I found really interesting about this is that this workforce is actually predominantly women. And so this is an issue where, you know, investing behind it kind of pays a triple dividend, as the WHO is saying. It's for health, it's for economic growth, but it's also for, you know, gender equality and toward gender equality, because right now those jobs are not being filled. Yeah, I mean, a lot of people looked at those solutions you just mentioned as kind of coming in and, you know, connecting people across those medical deserts, connecting health, you know, care professionals with those who need it. We haven't really seen that, you know, come online yet. We're also seeing, you know, this nursing shortage, but also fewer people looking to the sort of medical career path because of how expensive it is, how much debt they take on in school, you know, or we're seeing them look to cities or places where there already are healthcare professionals because that's where they think they can make, you know, enough income to pay off that debt and also to support themselves and their families. So it's creating those medical deserts here in the U.S. All of these trends are really going in the wrong direction if you think about it. That said, this year we did see, and you and I have talked about this, Jeff, some really big steps toward fixing some of these problems, one of which is several big medical schools, Cornell and others, starting to eliminate debt for entire classes of students, or starting to find sources of aid for entire classes of students. So I think there'll be a much more kind of acute conversation around ensuring that enough people are choosing that path to become medical professionals, ensuring that it's a diverse group of people who are doing that, a group of people who also are willing to live outside of major cities and metropolitan areas in the U.S. And also, as I said, a diverse group of people, because right now a lot of the people entering this profession are people who can afford school already,
Right.
and it's just perpetuating, that income inequality and wealth gaps and all that stuff that we see. Yeah, we've seen this demographically in several major economies and countries, and it's starting to show in the U.S. declining fertility rates. As you said, this has major implications not just for healthcare, but for just productivity in this country and
Yeah.
the future of workers and economies in different parts of the country, as well as the overall U.S. economy. So I think that we're going to be talking about that a lot more. I haven't studied up so much on why fertility rates are falling and what experts say we should do to combat that. But I just know that this is the most important kind of long-term trend, is literally the existence of people who can be productive and produce economic output all around us. Although we talked about a couple weeks ago on the network the rising cost of childcare,
True.
and another kind of generational shift has been, which is great for a lot of reasons, but women entering the workforce in much higher proportions than previous generations, and so that raises the question of childcare, or at least changes the equation from previous generations. And so there's a lot of push and pull and different variables going into all this.
And sticking with that healthcare theme, I sat down with the Motley Fool senior consumer and technology reporter Daniel Klein to get his perspective on healthcare tech trends in 2020 and beyond. Let's take a look.
So there's sort of a consumer-facing area and a doctor-facing area, and they both face similar problems. So imagine you've been a doctor for 20 years, or I'll give the example, I've been a journalist for 20 years. When the technology changes and your company decides it's going to use something new, it's always painful. That might be, in my case, a new content management system where you have to learn different buttons, different things. In the case of doctors, it's integrating technology into basic treatment. So that might be having medical records in an iPad, that might be using new digital diagnostic tools. And there are people, a buddy of mine does this for a living, he teaches doctors at a very high-end hospital how to use the technology, and there's a lot of resistance, and that's very understandable, because if you've done something a certain way and you're used to someone handing you a paper folder and that has the annotated records, and now all of a sudden you have to do all that on your thumb, with your iPad in your thumb, that becomes tricky. And you're already learning a lot. Then there's the consumer part of it. We talked about, I think it was last week, that I used Teladoc, or a Teladoc-like product, to have a small infection on my fingernail diagnosed. And I had to send them pictures, and I got a prescription, and it saved me money and a trip to the doctor. It was absolutely wonderful. But people are hesitant to embrace that. And we're seeing more and more companies make that type of service part of their system. Chipotle got a lot of news coverage this week that they're offering digital nurse visits to certify that employees are sick, so the employee can take the day off without having to sort of chance that they're going to get in trouble. On one level, that met some backlash with, well, why can't I just tell you I'm sick and not come to work? On the other hand, the intent of it was to sort of remove that stigma where you have a cold, but you go to work anyway and you get people sick. You don't want that in food service. So we're really at the precipice where all of these tools exist. There's all sorts of amazing things doctors can use. There's some really neat things you can use as a consumer to sort of not have to go sit in the doctor's office for routine prescription refills. When you have the same thing your spouse just got diagnosed for, it's pretty easy to go to Teladoc and hold up your wife's prescription and be like, she has strep throat. I feel like I have strep throat. They're going to believe you. They're going to give you a prescription. You're not getting opioids that way. You're not getting painkillers, but you can handle, very routine things. I'm asthmatic. I take prescription asthma medicine. I could jump on Teladoc and say, here's my last prescription. It expired. I need another 3 months or whatever it is. Cost me $25 instead of having to go to a doctor's visit, which can cost much more and take much more time. So I think you're going to see more consumers use it, especially as big companies adopt it and start having training seminars, because it really is better technology. But people are resistant. Doctors are resistant. It's going to take a while. I think we're at the earliest phase of just how useful these devices are. Your Apple Watch can tell you if you're having a heart attack. It can report it. There's all sorts of things that I think we're going to see routine diagnosis. Things like diabetics having their blood sugar checked just from their watch without a pinprick. And we're right at the edge of that. And you're starting to see Best Buy owns a company that does, call it medical assisted devices, to joke, but the old I fall and I can't get up technology where you push a button and someone comes, but taking that to like new levels where there's health monitoring, there's passive where like if you stop breathing in your sleep, it shocks you and wakes you up. I'm making that up, but like that level of technology, and you're going to start seeing watches that can do a lot more, and watches that can maybe analyze your sweat and tell you you're dehydrated or that you need more potassium or whatever it is. I am not wearing it at the moment because I just ordered a new one that is actually sitting in my mailbox, but I wear a Fitbit and I use it largely to track, have I elevated my heart rate enough during the day to be considered exercise, though it does consider sweating after a heavy meal exercise, so it's not 100% accurate. And I use it to track how many steps I've taken, because I try to take 10,000 steps in days I'm not working out at the gym. So those are baby steps compared to what this technology will be able to do. And we've gotten to the point that I think it's somewhat ubiquitous among a, let's call it upper middle class, wherever you and I fit in. And we're getting to the point that a $20 fitness tracker is going to be just something everyone uses. And even the Apple Watches, as they get more and more sophisticated, an Apple Watch 1 can still do incredible things. And I'm guessing you could find one for, probably under $150. So I think we're in the early days of what we'll call a revolution. There is a lot of interest for the health insurance companies to not have massive change, for them to remain in charge. But now that you have a health insurance company owns CVS, and CVS is working on democratizing healthcare with its walk-in clinics, and in a couple of markets they have a health concierge who helps you navigate what you need. So I do think you're going to see technology start to wade through this, and a lot of the sort of nonsense that's in the healthcare system in the next, call it 20 years, will get squeezed out. Because as much as it's a political issue and people, Obamacare, Medicare for all, whatever it is, the vast majority of people want people to have health care. And they look at something like a person doesn't have health insurance, so they go to the emergency room because they have, a cold. And it costs $3,000 that they don't pay, but that's the only place they could go. I think any person, no matter what political leaning you have, would say, well, if I'm already spending that $3,000, how can I spend it to treat 20 people? And technology and Teladoc and other things like that are going to figure into that. So on one hand, you have to break some of the profit motive. On the other hand, you have to sort of make it very easy to use and have consumers force it. And when you start to see big companies like Google testing different healthcare models where they're actually giving employees access to nurse visits, in-person nurse visits, and telemedicine and other ways to make it easier, eventually these kind of things become standards. I mean, we're not that long ago that the idea of an open office was crazy. And then more and more companies started doing it, and it became the norm. I think you're going to see healthcare as a company-involved service, just like when I worked in New York City in the late 90s, they would pick up our dry cleaning at the office, or at Motley Fool headquarters, there's a person that comes, I'm going to say once a month, but I don't know the cadence, so say once a month, to cut people's hair, because If you have a job, it is difficult to get certain routine things done during the day. If you have kids and have to deal with them at night, it becomes impossible. So there's going to be a consumer push for it, and that's going to be backed by technology. If your watch could tell you, oh my God, you have a virus, it can't do that yet, but let's pretend in 5 years it can, it might be able to get you the best course of treatment. Or you have a cold, your vitamin C level needs to be higher. Whatever it is, there should be technology to do that. And right now it's mostly focused on heart monitoring, but of all the things you don't want to break, your heart's really up there in terms of importance. So we're off to a good start. It does. We've talked about my mom before, who's like a pretty hip mother in that she uses Netflix, she has an iPad, she's pretty technically savvy. But if I said to her, use Teledoc, she wouldn't know what she'd be like, is that like a phone call where you tell a doctor something and he tells someone else? Like, she would have no idea.
Teledoc, right.
Yeah, and I do think you're going to have to use the senior centers and the 55 plus communities and do some outreach and some education, because that is an age group where you're seeing the doctor more. But if you're seeing the doctor for more routine things and you can do it virtually, doesn't replace getting a physical, doesn't replace some of the reasons you need to visit a doctor. But there are some things. I mean, I could look at my finger. I knew what was wrong. It wasn't, I wasn't going to go in and he's like, no, that's not an infection. You have Ebola. Like, it was pretty clear what I had. So that type of thing, and that's going to ease up the doctors in general. So if you take 20% of the routine traffic out of that waiting room, well, there's a possibility that I won't have a 10 a.m. appointment and at 11:30 be sitting there. They always take you out of the waiting room and put you in the room where there's nothing to do. Like,
That's true.
There's like a highlights magazine from 1987 and People's Man of the Year 2004. Like, those are your choices. Or you can read about diseases that are up on the wall. So the more you can sort of ease that congestion, it works just like Starbucks and mobile ordering. If a certain amount of people mobile order, well, they're not waiting in line. And you can change around your personnel to focus on service rather than sort of handling the customer. It's definitely going to be an improvement, but it is going to take some time for adoption.
And that wraps up this episode of BRN Weekly. I want to say thanks to David Levine and to all of our contributors this week. Amazing content. They're all such great experts, and we appreciate them spending some time with us each and every morning. But don't forget, we're back again tomorrow for our podcast, BRN Sunday, where members of the media, academia, and the financial services industry all intersect to talk about the news in retirement markets, technology, personal finance, and so much more. You're not going to want to miss this one, because we're talking about the Secure Act of all things. So definitely stick around and stay tuned for that. And don't forget, we're back again on Monday morning with BRN AM. We've got a shortened week due to the holiday, but that doesn't mean we're not going to be short on content. So until then, I'm Jeff Snyder. Keep on saving, and don't forget, roll with the changes.